Doctor, you would obviously be the one to ask this. Why is a lockdown, a house arrest, why is it so hard on people? Why? What is it that it just does not work for people? Because I think there's a lot of misconception out there, especially from people who are doing very well, mentally doing really well, that this is just Netflix and takeout and life is good. Why is this so hard for other people?
You know, it's great for people with obsessive compulsive disorder and social phobia. These people up until February were considered mentally ill. And now the hand washers, the Zoomers, the ones who don't leave their house, who play video games and do all their work online, the coders, they're virtue gods. People look to them for support and encouragement, but they're still sick. The healthy people, when I say healthy, I mean emotionally well people, they don't thrive in isolation. Those who are not autistic, who don't have social phobias, who don't have contamination obsessions, they need to spend time with people, and not just over the phone, not just through Zoom. They need in-person, shared space, shared time. We have thousands of people in LA. LA is a big entertainment industry town. There's a lot of drugs, a lot of alcohol, a lot of coke, and there are a lot of addicts here. The only way that addicts stay abstinent, for the most part, is by going to 12-step programs. And those 12-step programs have to occur in person because people receive actual support by sitting in the same space, sharing time and words and feelings with others who are also suffering and holding each other accountable. That doesn't happen in a Zoom meeting. It doesn't happen on a phone call. This is just one example of so many different aspects of our lives that are necessary to function and require actual space shared with other people. And we don't have that now. And worse, we're stuck at home with people who are antsy, irritable. Children are not able to go to school. Parents are trying to work from home and manage their children all at the same time. Everybody's on edge. There's a lot of poor sleep habits, poor diet, lack of exercise, worsening anxiety, worsening depression. I mean, you're basically just creating a cauldron of potential emotional collapse and physical collapse. And all of this is happening in the context of no access to medical care because all the doctors have been ordered to basically stand down and not see their patients. It is just horrible.
Doctor, I agree with you 100%. My question to you is, and I mean, you don't have to name names, you're welcome to if you want. I don't understand why other doctors, experts, scientists, whatever you want to call them, who are pushing these and we're pushing these and pushing these, how can they not see that? How can they not see the actual human cost of it? Because it was amazing to me from the very beginning. I've been screaming this exact thing, that you're treating America as if America's a virus instead of America having a virus. And it blows me away they can't see it. These are smart people. These are highly educated people like you. Why can't they see it?
I think the people on the ground do see it, but their voices are being silenced. The article I mentioned that I wrote for the LA Daily News, it was an op-ed directed specifically to Mayor Eric Garcetti, the mayor of Los Angeles, who has been essentially brain dead for the last 3 months, probably longer, but certainly since the shutdown occurred, who has locked the city down against all data, all reason, all science. That article was titled "Safer at Home?" ? That's the name of his policy, Safer at Home. I always find it ironic when I drive down the freeway in LA and I see these electronic lighted signs up all over Los Angeles saying, be a hero, stay at home, save a life, stay at home. And I think of all of my colleagues and friends who are in the military or retired from the military who literally risked their lives to save other lives. And we're now telling people that to be a hero is to sit on your ass and watch Netflix and binge on potato chips. And that is the official message of the city. So that op-ed that I published was turned into a YouTube video. 2 days after the video was published on YouTube, it was removed.
Oh.
It was called, the removal was titled, "Violates Community Standards." 2 days after that, 2 physicians, ER physicians who spoke on this using data, substantive data to prove their point and contention that staying at home and shutting things down does not save lives, it actually increases the loss of life. Those 2 doctors published their video. It wasn't even a video of them talking in their basement. It was actually an ABC 21 major news organization interview. It was aired live, and then it was uploaded from the news agency. 50 minutes long. It garnered 5 million views in less than a week. The day after my video was removed by YouTube, their video was removed too. Same rationale, violates community guidelines. So what I'm saying is there are doctors who are speaking up. They're trying, but they're being silenced. They're being literally censored off of Facebook, YouTube, and Twitter, whose official policies are to take down any statements or advocations of public policy decisions that go against what the governors and the mayors are advocating, which is lockdowns. So the only people you're hearing from up until recently, with our group, for example, are the national doctors like Dr. Fauci. And I think that these people, although I don't believe that they're evil or they have any malintent, I don't think that they have the capacity to speak objectively because they are so beholden to other interests, such as politics, such as reputation, such as not backing off and correcting themselves from earlier errors. And there's a lot of pride and a lot of ego involved. And with politicians, I think it's all about power. So it's really left up to the boots on the ground, the doctors like me and Dr. Gold and the others, Dr. Barkey, who's part of the group as well, a primary care doctor in Orange County, who was at the march and the rally on Sunday in downtown Los Angeles, to speak up and to give the facts and to give their opinions, not from a political point of view, but from the point of view of people really worried about their patients, worried about the health risks of society. I'm not even talking about economics right now. I'm just talking about physical health.
Dr. Mark McDonald, thank you so much for what you're doing. Thanks for giving us some time. Please don't stop. We need you out there. Hey, thanks so much for watching The First on YouTube. If you liked what you saw, go ahead and like and subscribe. You heard me. Like it, subscribe. You'll get a lot more of it and a lot more of me.